Your doctor has recommended that you have a colonoscopy. This video will review how to prepare for your upcoming procedure. Please watch this and review these instructions now so that you can successfully prepare for your colonoscopy. You will need to refer to the video and instructions again starting 7 days before your procedure. It is extremely important that you follow these instructions exactly so your doctor can clearly see the colon. If your bowel is not adequately clear, your colonoscopy may have to be repeated. A colonoscopy is an examination of the lining of the rectum and colon or large intestine through a flexible tube called a colonoscope. This allows a specially trained doctor to directly view this area and identify, biopsy, or remove any abnormalities such as polyps. Removal of polyps helps to prevent colon cancer. Bowel cleansing is needed to perform an effective colonoscopy. Any stool that is left in the colon can hide polyps and small cancers and result in the need to repeat the colonoscopy. If you take medications for high blood pressure, take them at the usual time on the day of your test with small sips of water. If you are a diabetic, check with the doctor who prescribes your medicines regarding your dose of insulin and other diabetic medications needed the day before and the day of your test. Inform your doctor that you will be on clear liquids the day prior to your test. Typically, it is recommended that you do not take your diabetes pills or insulin on the morning before your test. Bring it with you to take after your test. Check your blood sugar often while taking the PrEP solution and on the morning of your test. If you are taking aspirin, please check with your primary doctor and ask if you should stop it. If you are taking aspirin due to a doctor's order to prevent stroke or heart attack, we generally recommend you continue to take it. If you are taking Coumadin or any other blood thinners, ask the doctor who prescribes your medicine how to take it before and after your test. If you cannot contact your doctor, call us several days before your appointment. Do not stop taking any of these medicines without talking to your prescribing doctor. 2 days prior to your test, try to eat a low-fiber diet. This means you should avoid foods with seeds, popcorn, corn, nuts, fibrous vegetables, and fruits. Obtain the following over-the-counter items from your pharmacy to clean out your bowel: 1 bottle of Miralax, the 238-gram dose, 4 Dulcolax laxatives, bisocodyl tablets, the 5-milligram dose, 2 32-ounce bottles of any flavor Gatorade except red or purple in color. You will need a total of 64 ounces or a half gallon for your PrEP. If you have diabetes, you will need 64 ounces of Crystal Light Hydration Lemonade solution instead of Gatorade. The day before your colonoscopy, do not eat solid food or drink milk or alcohol for the entire day before your test. Drink clear liquids only all day. Drink 8 ounces of clear liquid every hour while awake. At 3 p.m., take 2 Dulcolax laxative tablets by mouth. At 5 p.m., mix the entire bottle of Miralax in 64 ounces of Gatorade or Crystal Light Lemonade Hydration solution to make the PrEP. Shake the bottles well until dissolved. Drink an 8-ounce glass every 15 to 30 minutes until you drink half, 32 ounces of the PrEP. This should take 1 to 2 hours, and refrigerate the remainder for later. At 7 p.m., take the last 2 Dulcolax laxative tablets by mouth. The day of your colonoscopy. 6 hours before your scheduled arrival time, drink the rest of the Miralax solution at the same rate. This should take another 1 to 2 hours. You may take your usual medications at your usual times with small sips of water. You must take both 32-ounce bottles of the Gatorade Miralax solution as directed to clear your bowels. Do not take more than the 238-gram dose of Miralax. The following clear liquids are all okay to drink. As a rule, if you can see through it, you can drink it. Juice without pulp: apple juice, white grape, white cranberry. Soda: Gatorade, ginger ale, clear-colored lemon lime. Coffee or tea without cream, powdered creamer or milk. Flavored bottled waters: popsicles, water ice, Jell-O. Broth: beef or chicken. Preparing for discharge, you will be given relaxing medicine for your colonoscopy test. This medicine can slow your thinking and moving. For safe recovery from this test, you must plan to have a responsible adult take you home and stay with you. If you are planning to take a bus, cab, taxi, or paratransit home from your test, you must have someone with you other than the driver. If you do not have a family member or friend who can take you home and stay with you, you can arrange for help with a home care companion service for a fee. Please call us if you need the name of such a company. The hospital will cancel your test if you do not make these plans. On the day of the test, completely drink your bowel preparation solution. Do not use chewing gum, lifesavers, breath mints, etc. before your test. On the day of the test, please bring a list of all the medicines and dosages amounts you take, including prescription and over-the-counter medicines, eye drops, vitamins, herbs, and supplements. You may bring the medicine bottles themselves. Bring a list of your allergies or reactions to any medicines. Bring the name, address, and telephone number of your family doctor. Bring your photo ID, insurance cards, and referrals, if applicable. Please remember any out-of-pocket expenses such as co-pays, co-insurance, or deductibles are expected to be paid prior to your test. Pack lightly and wear loose, comfortable clothing. Leave your money and all other valuables at home. The test takes about 30 to 60 minutes, but plan to spend 2 to 4 hours at the unit to allow time for your preparation, your test, and your recovery. Every effort will be made to keep your appointment at the scheduled time, but in medicine, unexpected delays and emergencies may occur, and your wait time may be prolonged. We give each patient the attention needed for his or her test. Before the test, a nurse will greet you and help you change into a hospital gown. The nurse will place an intravenous line, IV, in your arm. You will receive relaxing medicines through the IV during the test. You will be lying on your side during the colonoscopy. The colonoscope will be passed into your rectum to view the lining of the rectum and large intestine. After the colonoscopy, you will go to a recovery area where a nurse will watch you until most of the effects of the relaxing medicine have worn off. You may have some cramping or bloating because air is placed into your large intestine during the test. This should go away after several hours. The doctor may talk to you about the results of your test before you go home. The nurse will give you information about how to take care of yourself at home. A copy of your test report will be sent to your referring doctor. We will provide a phone number for you to call for results of biopsies or other tissue sampling performed during your test. Remember, a colonoscopy is a simple procedure that could save your life. It is extremely important that you follow these instructions exactly so your doctor can clearly see the colon. If your bowel is not adequately clear, your colonoscopy may have to be repeated.